The mood-stabilizing medications include drugs like lithium, valproic acid, and even carbamazepine. Lithium, of course, is a wonderful drug, and it's mostly used for patients who have bipolar disorder. And it is considered first-line medication for patients who have bipolar disorder, and it's also used as an adjunct to antidepressant medications when patients are not responding to antidepressants alone. Lithium has a lot of side effects, including tremors, GI disturbances like diarrhea, headaches. It can worsen acne. It can cause rashes. It may cause weight gain. And of course, it can affect the conduction of the heart. It can cause hypothyroidism, and that's why you always must assess TSH before you start anybody on lithium. It can cause leukocytosis. You do see polyuria and polydipsia, so nephrogenic diabetes insipidus is also a common side effect. So you want to make sure that you check kidney function before you start anybody on lithium, given that lithium is also nephrotoxic. Lithium, of course, is also teratogenic. It has been known to produce Epstein's anomaly, which is a problem in the tricuspid valve in the fetus. So anybody who is pregnant should not be on lithium as well. So pregnancy test is another test that you would want to get on any female who is of childbearing age before you start them on lithium. Now, given that patients can become hypothyroid on lithium, you want to make sure that you keep the plasma level below 1.5 to reduce the risk of hypothyroidism. Because you can see dehydration and hyponatremia on patients who are on lithium, you also want to make sure that the patients are adequately hydrated, the patients stay out of the sun so they don't sweat excessively, and of course, make sure that you keep the level below 1.5. Anytime a patient's level is below 2 or 2.5, the treatment of choice will be immediate dialysis. And when you have levels above 2, also you might see gait disturbances or ataxia in these patients. The way we can help with the tremor produced by lithium is that, of course, you might try lowering the dose in order to reduce the tremors. Also, try dividing the dose or slow release types of lithium to help reduce the tremor as a side effect. Divalproex or valproic acid is also very good for bipolar disorder, especially if that is a patient who is a rapid cycler, or when lithium is not effective, or when lithium is impractical or contraindicated. For example, patients who have kidney disease or kidney failure should not be on lithium, so divalproex or valproic acid would be the first line in these situations. Valproic acid or divalproex is very popular in emergency settings only because a loading dose can be given. So you're getting much more of the medication into these patients much quicker. It also takes 10 to 14 days for valproic acid to work, very similar to that of lithium. Now, the common side effects of valproic acid could be sedation, cognitive impairment. You also get tremors. You also get GI distress, especially a lot of nausea, a lot of vomiting. It is hepatotoxic, so you want to make sure that you check liver function, and it has possible teratogenicity causing spina bifida. So always make sure that you check pregnancy status on any female who's of a childbearing age. Carbamazepine, even though it can be used for the treatment of bipolar, for the purpose of your exam, it's rarely used first line. So it's mostly indicated in those patients as second line. Patients who have been on lithium, patients who have been on divalproic or valproic acid, and basically it's not effective. One of the problems with carbamazepine is that it can cause agranulocytosis, and it does have a lot of sedation as well as hepatotoxicity. So as you would with valproic acid, make sure that you check LFTs before you start anybody on carbamazepine. Now, lamotrigine has been used for patients who are bipolar, specifically of the depressed type. The problem with lamotrigine in patients is that you worry about the Stevens-Johnson syndrome, which is a rash that is potentially lethal. So remember, for the treatment of bipolar, first line should always be lithium. However, antipsychotics can also be used, especially if you have a patient who is in acute mania and a patient that you cannot wait a week for the lithium to take effect.